Welcome back. The holidays are here, and while it's a great time to get together with loved ones and celebrate, it can also be a stressful time of year.
That's right. Here to help us focus on our heart health is Dr. Stephen Portz. He's Chief of Cardiology at Healthcare Partners Medical Group. How are you?
I'm good. How are you?
Hello.
Doing all right. Well, it's a sad fact, but it's truth. Holidays and heart attacks, they coincide. Heart attacks go up this time of year, right?
Yeah, it really does. It's been shown we can expect a 5% increase during the holidays here, especially around Christmas and New Year's. Also, you just saw a clip on atrial fibrillation that really occurs more around this time as well. So we get quite busy. A lot of stressors can do that with the lack of sleep, the partying, the drinking, the excessive eating. Other stressors that can bring that out are, it's flu season, so it's important to get those flu shots. When you have underlying disease, you develop a disease like influenza can really bring that out.
Yeah.
And a lot of pressure with the needing to go shopping and the pressure of gift giving, and then the stress of, oh my God, how am I going to pay these credit card bills?
How am I going to wrap this?
And then the depression around the holidays is a lot. All of that contributes to the increase in disease that we see at this time of year.
No question.
What are some of the symptoms we should be looking out for?
Yeah, the symptoms can be quite variable, and they may be very different in men and women. Many times they're very subtle, so you really have to pay attention to your body and the symptoms that you feel. So if you notice things like excessive fatigue, shortness of breath, it's more than what you're used to, not just because, well, I'm 65 now, I'm not 30. Pay attention to that. And sometimes the pain from heart disease, patients don't call it pain. It's just like uncomfortable. It may feel like you just ran a 100-yard dash and you're feeling a little bit tight in there. Many times it's somewhere else besides the chest as well.
How can you prevent cardiovascular disease and heart attacks? Is there a way to, obviously diet and exercise, I would assume would be top 2 on your list.
Right. Yeah, it's never too late to start, but it's a lifelong deal. Yeah. And nutrition, exercise, weight control, it prevents so many different diseases. So nutrition is a real issue. Lean, healthy proteins, lots and lots and lots of vegetables, 1 or 2 fruits a day. We can't cut out completely, but try to cut out as much as possible or reduce the calories that have no nutritional intake or value, like breads and pastas and rice and potatoes and chips and tortillas, especially sodas, desserts, and candies. And we have to enjoy all of that. Exercise is really key, both for blood pressure control, weight control, your overall feeling of good health. I encourage my patients to exercise 5 to 7 times a week. And if they do a formal program 4 or 5 days a week, I ask them, go get energetic and do something else just a little bit on those other 2 days off. It's just really key.
Yeah, and obviously there are medications out there that can lower your cholesterol, help you get well.
Correct. I mean, if in an ideal world, if we could have great nutrition, weight control, and exercise, a lot of these medicines wouldn't be needed. But when they are needed, they're very, very effective. And there's a lot of fear in taking those medications, but they're important when you need them for blood pressure and for cholesterol and heart problems.
Let's talk about the benefits of Healthcare Partners and the total care model that you offer, especially to seniors.
It's a unique program, and only one that really has any kind of model like that here in Nevada. We have a team that's really put together with your primary care physician at your quarterback. You have caseworkers and nurses and your specialists. We're all on the same electronic health record system. We can view all of your records live. We are a team for the patient's health, and we really incorporate the patient. The patient must become part of the team and really participate in their care. And it's a unique model. I think you can see that in our outcomes that are followed by the federal government each year.
It's almost like concierge service for seniors.
It is, without paying for the concierge.
Exactly,
right.
And that can get very expensive if you pay for
right.
that. Now let's talk about open enrollment. That took place in the middle of this month. What exactly is it, and how long does it last?
It's a time of year where seniors or Medicare eligible patients can either add to or change or improve their insurance. And it's important to realize there are many changes that occur every year. So look it up. There's a lot of information on our website. While you're there, look at our cool video we made on our cardiology division. I think that you'll be very impressed with what we have to offer, the kind of care we want to deliver. But look it up. There's a lot of options, and I think that we really offer good choices.
No question, and that's why it's so important to make sure you pay attention to the selection that you made during Medicare open enrollment.
It is. You have to stick with it for the year.
Yeah.
And but you have the option next year as well.
Yeah, it's not junk mail that comes in the mail. You really need to open it and look at it.
It is important, and I'm impressed with how educated seniors are when they speak to me about these different programs.
Yeah. Awesome. That means the word's getting out. That's good.
Yeah.
Doctor, it's great having you.
It's always good to be here. Thank you.
Thank you
so much. Take control of your heart health. You want to learn more about Healthcare Partners Medical Group? Check out the information you see on your screen.
on KT.